Our press conference this afternoon focuses attention on the impact of insecurity and COVID-19 on soaring prices of foods in Nigeria. Increase in food prices have been a major cause of fear and concern among Nigerians, especially the poor and vulnerable groups in the communities. Soaring food prices have striking consequences on hunger and malnutrition. Nigeria, being Africa's most populous nation, with over 200 million people, competes with countries like India for the largest number of poor people in the world. Nigeria has experienced the double economic impact of low global oil prices and the COVID-19 pandemic. Food prices have increased more than 22% since the start of the coronavirus crisis, according to National Bureau of Statistics. The World Bank estimates that Nigeria's soaring inflation and food prices pushed another 7 million people into poverty in 2020, in January 2020. Maize, wheat, and rice prices were about 43%, 12%, and 10% above their January 2020 levels. The rising inflation has adversely affected the profitability of producers and is a major contributor to the low export penetration of made in Nigerian goods, particularly at the international market. There is therefore an urgent need to ensure price stability before the situation becomes more deplorable. The ever-increasing food prices can be attributed partially to the insecurity situation in the country and the emergence of COVID-19 pandemic. Widespread banditry, ethnic clashes have kept people from working on the farm and trading in the open market in some parts of the country. In some parts of the country, the number of severely malnourished children is climaxing. Food availability at markets is declining, especially for fresh, perishable foods such as fruits and vegetables and animal-sourced foods. The implication of the impact means that there is a reduction in the number of farmers due to their experience of banditry. There is impoverishment of farmers due to kidnapping. Farmers are not willing to go to their farmlands as they will be chased out. Cattle rearing has become difficult. There is reduction in the quantity of crops stored in grain silos. This clearly indicates the negative impact of insecurity and banditry on food security. Food prices will remain elevated until the security crisis is solved. Besides, the COVID-19 pandemic has spread rapidly and extensively around the world since late 2019, and this has had overwhelming implications for food security and nutrition. The unfolding crisis has affected food systems and threatened people's access to food via multiple dynamics. We have witnessed not only a major disruption to food supply chains in the wake of lockdowns triggered by the global health crisis, but also a major global economic slowdown. For school children, the closure of schools, especially where school feeding is implemented, will also have adverse effects on children's nutrition, especially where school meals form an important source of nutritious food for children. Reopening of schools and school feeding seems to be one of the important early actions when the COVID-19 burden reduces to ensure adequate diets for children. Both undernutrition and overnutrition entail important risks for health, amongst others, through an impaired immunity response, increasing the susceptibility to infections such as COVID-19, as well as the intensity of infections, complications, and mortality due to COVID-19. Studies conducted in Nigeria during the peak of COVID-19 pandemic reveals that among children under 5, the prevalence of undernutrition measured by low height for age and weight for age is relatively high. Transform the food system in Nigeria to deliver adequate and appropriate healthy diets, such that those that are currently malnourished can be rehabilitated, can be taken care of in such a way that we can reduce the level of malnutrition. Those that are taking too much and are probably on the overweight and obese side can also be educated appropriately so that we can also reduce the level of overweight and obesity in our population, which is another form of malnutrition. If you look at it, most of these manifestations of malnutrition are drawing down on the country's economy, because a child that is malnourished, an adolescent that is malnourished, will not be able to develop appropriately and cannot contribute to economic and national development. The same way that those who are overweight or obese also are at risk of other non-communicable diseases like diabetes, cancer, and so on and so forth, which are also drawing on the country's health spendings. And of course, it also impacts on their health and well-being, such that it also brings about a reduction in their productivity. So the focus of this conference is first of all to create awareness on the deplorable state of the food system in the country and how this can be fixed in order to solve the problem of hunger and malnutrition.
The purpose of that project is to raise awareness and deepen the understanding of people in academia and other nutrition professionals around issues of very dire importance in the nutrition landscape in Nigeria. The Project ENA targets our scientific conferences and supports us in shaping themes for discussion such that we are not just globally relevant, we are also locally relevant. We are solving local problems that have global dimensions. So for this particular conference, we have been talking about food systems for healthier diets, just like the President of the Nutrition Society of Nigeria has said. And one of the issues that has come out is that we have to make sure our business, our research is tailored towards solving our problems, and not just tailored towards solving our problems for food systems. We must always also think in terms of the business aspects. These are some of the things that Project ENA has supported us to dialogue around this conference. Thank you very much.
Thank you very much. Yes, there are statistics from World Bank, from the Nigerian Bureau of Statistics, and other sources, particularly from development partners. Currently,
If we start looking at it one by one, according to Nigerian Bureau of Statistics, about 83 million people in Nigeria are said to be living below the poverty line. 83 million people. 83 million people, as at 2019, are living below poverty line, according to the Nigerian Bureau of Statistics. Okay? And of course, you know that we mentioned that Nigerian population is over 200 million. I think about 212 as at the last count, million Nigerians. You know, that's our population. And from that, the insecurity caused by Boko Haram alone has left about 8.5 million people. 8.5 million people are being left to be seeking for humanitarian assistance to get food. The implication of that is that that crisis alone, that insecurity crisis alone, has left 8.5 million people out of their homes and lacking access to food. So that alone has given us, statistics that as a result of insecurity, we have a lot of Nigerians that are no more living in their home, are living in what we call IDPs, internally displaced points in the country. Apart from that, the number of children that have also become malnourished in recent time as a result of insurgents has also increased very, very tremendously. Very, very tremendously. And this is also localized to particular regions of the country. For example, in Borno State, which is the epicenter of insecurity, over 64% of the households have been, identified as being food insecure. Over 64%. 64%. What that means is that we are talking of 3 out of 5 households are food insecure. The implication of that is that 2/3 of households in Borno State are food insecure, arising from the insecurity crisis that we have around that part of the country. Okay, thank you very much. I think here we have experts in nutrition. So the first one on the issue of pollution and non-communicable diseases. I want Professor Ngozi Nam, is a former president of Nutrition Society of Nigeria. He's also a member of BOT, Board of Trustees of Nutrition Society, and the current president of Federation of African Nutrition Societies. So please stop.
That is a major problem which the food system is trying to address. The issue of pollution vis-a-vis the spreading of non-communicable diseases. It's an important area because at times we think that non-communicable diseases is just linked to the diet, the eats. It's not just the diet. That issue of pollution coming from industries and the rest of them is an aspect that helps in the spread of these non-communicable diseases. And what we are trying to do about it is to have policies that will address some of these industries that leads to this pollution. Where those industries should be cited. You see, in some towns, the industry is just behind the residential building, and most of the pollution are being inhaled. We know that there are gases that are not good for your health. The one we take in is oxygen. That is the air that is good for us. But you see, these industries, they have gases that are not good for our health. And when they are produced from these industries, the habitats around that area also are liable to being a victim of these pollutants. And that's one of the areas, this national dialogue on food system. That's one of the areas that we need is drawing our attention to, particularly the siting of these industries, to ensure the safety aspect of individuals around such locations, because such gases can cause serious diseases in terms of non-communicable diseases in the health system. So the it's being addressed, to see that appropriate measures are taken in place to ensure that these industries are far away from habitation so that they don't cause pollutants. I know that in areas like Port Harcourt, you have industrial zone where they have the industry, but in some other areas, the people are intermingling with these industries, and it's not good for our health. Thank you.
The second aspect,
We know that is, let's say, traditional problem part of the world. It's okay to say the fact that those families, are very important to those food. Your concern is what NSN is doing to close the gap. As a society, we are professionals, and what we are not farmers, number one. Number two, we are not policy makers. What we do as a society is to educate the people. We make available what we call nutrition education, and we also depend on people like this press conference meant to address an issue. You agree with me that even in our local settings, the farmer goes to the farm, sells a trap. By the time he catches one, deep bush fowl or grass cutter, whatever it is, the next thing he does is start to take it to the village square or market to sell, or stay by the roadside to sell instead of putting it. So it's a problem. So the only way to address that is nutrition education. We know things are hard, but we still need to talk to ourselves that these things are important. They have oranges or other fruits which we don't control. Everybody wants to turn everything to cash in hand. And at the end of the day, we end up buying bread, we end up buying toast, biscuits, and all these processed foods. And the food is not usually done. So as a society, we are talking. The nutrition education we can do. We can't give the people food to eat. And the government also is doing, has to do it so hard. That is why NSN as a society also collaborate with government. We work with government, we work with all stakeholders to ensure that issues like this are addressed. We don't have the money, but we have the knowledge which we can share so that form policy and then go to affect influence the feeding habits of our people. And this food system, we have all we need. We have all we need. It may not be sufficient, but we have all we need. Nigeria is blessed. All that remains is to let the people go. Healthy diets are important. And that is why we are talking about healthy diets now. It's not, I know some of you journalists, when you finish from here now, the next thing to enter one place, you cool down the food, the next thing, a big bottle of salt free. You don't even bother to eat this food, go and take all these snacks. They are not healthy enough. We have fruits, vegetables, we have vegetables, which we don't even introduce to our children. And most children don't even like to eat it because we don't enforce it, we don't encourage it, and we don't even make it available. So we all have to work on that. And that is what NSN is doing. Through this conference, watch very well. We have stakeholders from different backgrounds, some from industry, some from NGOs, local and international, some from universities, some from ministries, and NSN is bringing all these people together to address problems such as that.
Ministry of Humanitarian Affairs is present here, and they want to partner with NS Nutrition Society of Nigeria, particularly in the aspects of monitoring and evaluating the impact of their program. But, you know, we have had discussions with them. Their request came late. Otherwise, they would have probably made a presentation at the plenary here. But because their letter didn't come on time, they were lobbying us to allow them to make a plenary presentation, though we have find another means of accommodating them, but not in a panel session. Maybe during parallel session, they want to inform us how much they have done, you know, and how far they have gone. But we told them that we are open to collaboration, just like we said in my opening statement yesterday, that NSN is open to discussions and collaboration with all stakeholders to solve this problem, just like the immediate past president said now, you know. So, what they are doing currently, what you are hearing is what we are hearing. But as a professional association, we have the capacity, the knowledge, and the skill to monitor what they are giving to children in those schools, to measure the portion sizes and what benefits those children can derive. Because if we don't do it, just like you mentioned, you know, vendors can do whatever they like. Different states can do whatever they like. You know, the product they are giving to children, the food they are giving to them is a product of collaboration between the federal and the state. So we have the capacity to do so, and when we sign the MOU, NSN is going to be involved in monitoring as well as evaluating the impact of the school feeding program in Nigeria. Well, I will have the Vice President North, Dr. Salisu Mewada Abubakar, to please respond to that.
Okay, thank you very much, sir, for the opportunity to speak to the press. I think it's a very valid concern that our population. I think there is that projection that by 2050 Nigeria will be on top of those countries that are having the highest population or among them. And we are battling with poverty on the other side. If we have to put the two together, birth rate and nutrition, if I may take it that way, you know, is something that we are having a lot of concern about. Normally we take it as from cultural angle. Many years ago, for instance, some decades, it's difficult for you to come to Nigerian communities. You start talking about birth control. You start talking about child spacing. You start talking about family planning. That way. But nowadays we will see, because people are informed, people are trooping to the facilities, looking towards on how best they can manage themselves in terms of reducing the number of children that they have, so that they have enough that they can catch up. And that is at the level of those who are elite to be polite to the court. We still have that from the north, for example. We still have that concern, all these out-of-school children that are coming from different villages. The problem of those people that don't have these knowledge, and they tend to put them up to the community to take care of. And at the end of the day, these people will not get notice enough for them in terms of food. So even to eat enough, regardless of the quality of that food, you know. So it's really an issue, but as society, like you keep going back to that point. Issue of collaboration, you know, that's like always a system, you know, it involves so many stakeholders that will work together to see how best these issues can be addressed. On the side of government, I'm sure the Ministry of Humanitarian Affairs, together with other ministries like Population Commission, I know there used to be discussion around that area on how best to enlighten people, including the Ministry of Health. And that's why now our facilities have all those services of family planning that people can access. And I'm sure in the near future, this issue of poverty and population will be addressed in the country. But as we are now, yes, it's a concern. And at some point, we used to try as much to say that poverty may not necessarily be an issue in terms of when you look at the need for food and nutrition in particular. I'll give you an example. If you look at a small village. I'm a villager from village. You know, all this our backyard. Okay, we have a lot of things. My boss have spoken in terms of education. We have a lot of food, especially sometimes seasonal issue matters. That's why sometimes we begin getting right. Once something is out of season, then it's difficult. But no matter how many you are, you see that in that family surrounded by a lot of things, vegetables, fruits that are local, okay, that they can feed on, and that can be enough. But then, what is happening? They tend to take all those things away themselves. At the end of the day, what are they doing with that money? Instead of going to ceremonies, now we spend one off ceremony and come back to another sphere and our production is seasonal. So there are many ways to address it from the angle of this providing facility. The major one is enlightening people to understand the connection between the issue of poverty, vis-a-vis family planning and
Yes, I want to let us know that eyesight is related to the food we eat, because there is what we call provitamin A, beta-carotene, that contains a lot of pigments that will help the eye to function well. And literature has shown that people who consume foods that are very rich in this beta-carotene, like carrots, like our green vegetables, common vegetables, green, yellow, orange vegetables, they contain a lot of these pigments, carotenoid pigments, that will help the rhodopsin of the eye to function well and focus well. So when we are eating most of these carbohydrate foods that are deficient in carotenoids, then gradually the person starts developing poor eyesight, and the eye starts deteriorating. And if, for example, you start eating these foods that are rich in carotenoids, particularly beta-carotene, the eyesight will start correcting. I can read very well without my glasses, because as a nutritionist, I practice what I teach. I eat a lot of those fruits and vegetables. So they are working to help the eye continue to function well. I don't think that poor eyesight is necessarily connected with it's as a result of malaria or whatever. If there is a mix between hereditary and environment, but we can overcome it with environment, what is around us, what we eat. And you see people at age 70, they can read without their eyeglass. Basically because they are paying good attention to fruits and vegetables. That takes us back to what NSN is doing about this carbohydrate food and whatever. This conference we are seated in is in fact one of the arms. This project is one of the arms of educating. Nutrition education is key to all these things. It is one of the arms of educating individuals. We have, like the president said, we have multidisciplinary people attending this conference. Take for example, during the opening ceremony yesterday, the minister of, commissioner of budget and planning was there, and he gave a goodwill message. In his goodwill message, he said that he has learned one thing today, and that what he has learned is that the palliatives they were giving was not appropriate. They were giving rice and oil, and Indomie and the rest of them. And that one thing we learned from the keynote address is that those palliatives were not nutritionally adequate because you don't have fruits and vegetables to address these other issues. That he has taken note of it. Is it not a clever way of passing nutrition education? That he has taken note of it, that next time they will do better. So this conference is serving a very big purpose to spread the message of nutrition education to different segments without extra bringing them together. They are here for the conference and they are taking the messages to their various tentacles and it will continue to spread.
Thank you very much.
The press is the arm of our community that spreads information. You can influence people's behavior, either positively or negatively. And we are hoping that when you go out of here, the kind of report that we generate from this press conference is going to help in disseminating information about nutrition. To also say that the Project ENAN, being supported by Bill and Melinda Gates Foundation, and that is being implemented by Nutrition Society of Nigeria, has also partnered with the press. We have trained journalists, particularly on reporting COVID-19. I think reporting nutrition as it's affected by COVID-19, as nutrition affects COVID-19 when that crisis started. That was heard, virtually, I think, in Lagos. That was last year. We still continue to partner with press, and we hope that anytime we call you, that you're going to answer us. Thank you very much, and God bless you. It's a pleasure.